You're a mom, you're pregnant, and you're pro-cannabis, and you're in a legal state. Then why are you being reported to DSS? Cara Crabb Burnham has been there, done that, and she's a cannabis activist. She joins me next on this episode of Canna Moms. Canna Moms is a podcast on the Pro-Cannabis Media Group that we produce every week out of our studio in Wellesley, Massachusetts. And I'm your host, Joyce Gerber. Hi, this is Joyce Gerber, and I'm your host today on Canna Moms. And today we'll be talking about how policy impacts pregnancy when cannabis is part of a woman's health care with my guest, activist, policy changer, mom, Cara Crabb Burnham. Welcome, Cara.
Thanks, Joyce. Thank you for having me.
It's great having you in our studio. I know we've talked before about some other things, but today, even though you have a very big cannabis story, I want to focus a lot about what you did to change the policy when your son was born. So I guess to start with, let's talk about a little bit why you were using cannabis, maybe the healthcare issues that brought you to that point, and then what happened when you decided to be transparent with your healthcare providers.
Yeah. So I've always been really open about my cannabis use. It never bothered me. You know, as far as I was concerned, what are they going to do? Arrest me? I mean, they could have. They didn't.
But you were having some specific health care.
So I have a seizure disorder that is not epilepsy.
Okay.
And part of my treatment of this disorder since I was in my early 20s has been using cannabis.
And was this something that was recommended to you, something you found on your own? How did you get into the cannabis use for healthcare?
I enjoyed cannabis, and then I figured out that it was helping.
Okay.
My medical benefits were a side effect of my recreational cannabis use.
Interesting. Okay.
So I was like, oh, this is working. Okay.
I feel better.
I feel better. Let's keep doing this.
Okay.
And I was open about my use for the 5 or so years that I was a patient in the neurology department at Brigham and Women's.
So you were open with your all the medical providers who were with you?
My female doctor, my primary doctor.
And what was their reaction to you?
You know, before I was pregnant, it was, we can't recommend it. You're going to do what you want to do. If you think you're having any of these addiction problems, these are, if you're not going to work, if you're losing your friends, if you're...
Did they seem to have any understanding of what cannabis really did? Or
No, they didn't know.
They didn't know, okay.
They didn't know. They believed me when I said it was helping me. And I continued to take, for a long time, prescription medication along with my cannabis use for my seizure disorder.
Okay.
And then when I decided that I wanted to become pregnant, when I decided that I wanted to become pregnant with my husband at the time.
Okay.
They'll edit it. I went to my neurologist and explained the situation, and I had to be removed from medications that I was on at the time.
So for the pregnancy? For
the pregnancy.
Of course, yes.
So 6 months before I even went off of birth control was that 6 months I played with various pharmaceutical drugs to try to, figure out something that would help me that wasn't a teratogenic, teratogenic meaning that it would cause significant birth defects.
Okay, something that was known. Okay.
Yeah.
Okay.
And
so you were being cautious.
Absolutely. Absolutely.
As a new mom, as we all are.
Yeah.
Right, exactly.
And I knew I knew that there was going to be risk. I knew that I could have a seizure that could cause, damage to an unborn child.
Right.
So and hormones had always been a huge trigger for my seizure activity.
So were you getting any support medically in terms of, so that people you were working with were aware of it, but were you getting any sort of supervised medical help from anyone who understood how cannabis was interacting with your body and your...
None of my doctors at the Brigham and Women were comfortable or terribly familiar with cannabis, but none of them were against my use.
Okay.
I did have a cannabis recommendation from a recommending physician here in Massachusetts throughout my pregnancy. So I did have a recommendation. I was a legal registered patient in the state of Massachusetts.
And then when you finally were pregnant, what were the doctor's reactions to you?
Well, there was the doctors themselves that were treating me were, like I said, they weren't against it. They were, cautiously optimistic.
Okay. They were open to it.
They were open to it.
Okay.
Because they knew it was helping. They knew that I couldn't be on the traditional seizure medication I had been on.
Right.
And the anticonvulsion medication because it was very dangerous.
Right.
So they said, well, if you're going to be pregnant, having elevated stress hormones, having seizures, having, anxiety, having depression, having, with this one natural medication that you can take in a variety of ways to solve a variety of problems.
Exactly.
We're not going to get on your case about it.
Okay, however, here's the big however. However, people.
My doctors were wonderful.
Yeah.
But then there's policies and laws.
Exactly.
And
policy.
there's totally two different things, these policies and these laws.
Exactly.
There are not laws against women using cannabis in their pregnancy. No. There are not laws that force a hospital to report anything. Those are all policies. Policies can be changed.
Policies can be changed.
Policies just take somebody important signature and done.
So you began the process of changing the policy. So what was the policy? Can you tell? What was the policy?
The policy at Brigham and Women was, and at most Massachusetts hospitals is that if a child is if there's suspicion or known use of cannabis or any other drugs throughout, not including legal drugs, like even though cannabis is legal, not including methadone, tobacco, or alcohol. So those are fine. So you can use those and you're fine.
You can smoke, drink, or take opiates, but
methadone.
Oh, methadone, sorry.
Yeah, if you're on those, then you're totally fine. Nobody cares. But if the child is born, the first bowel movement is called the meconium, and it goes back into the infant system for 4 months. And if they can test for THC metabolites or cannabis metabolites inside the meconium, then a 51A form is filed to the Department of Children and Families.
And is this something that every hospital does? Do they test it? No. Yeah. All hospitals test the meconium?
Oh, no, only if you're suspected or open.
Suspicion. Oh, interesting.
Suspected or open.
Okay.
They will test.
Okay, so
they will confirm that it got to the.
So basically, they're accusing you of abuse. Okay. Essentially abuse. Okay, so then what happened when you?
So the first step was the hospital social worker coming and having a sit down conversation with me.
And how pregnant were you when you started this process? Do you remember?
Oh, my doctor knew right from the beginning. But I don't think I talked to the hospital social worker until I was probably 6 months.
Oh, so you're 6 months. Okay. So you knew you were going to deliver in that hospital.
I knew I was going to deliver there. I knew that they were going to eventually make me sit down with the social worker. I knew that the social worker was going to talk to me about and what the next steps were before the social worker said.
You're prepared for this.
So the social worker sits down with me and is telling me, we're going to have to test the baby's meconium, and when we find it, then we have to file this form, and it goes to Children and Families, and then Children and Families is going to call you. They're going to come to the hospital and do an investigation with you. They're going to go to your home and they're going to walk through your home and make sure they do an investigation of your home. And then they're going to follow up with you regularly and see if you're
So you have a medical marijuana card. Yep. You're using it within all the parameters of the legality of our state. You're being transparent, and they're saying as soon as your child's born, we're going to basically say that you're abusing your child and file a complaint against you.
Yeah.
Okay.
So I met with
That's a little upsetting.
It was ridiculous. Right after I met with the hospital social worker, my doctor had me meet with the NICU. Okay. They assumed that since my child was going to be born of a Canna Mom, that he would immediately need to be rushed off to the NICU for observation.
For what kind of observation?
I don't know. Withdrawal symptoms.
Okay, so they interesting.
Which is again ridiculous.
So I mean, the problem with this is that it can't be tested. No one's going to test a pregnant mother. All we have is anecdotal information. They're not going to do scientific tests on pregnant women.
They have.
Oh, they have?
They have. There have been studies in other countries. There was a 40-year Jamaican study.
Oh, there was?
Yes. And it showed that babies that are exposed to cannabis in utero, their brains and their motor skills and their abilities develop faster than most children up until the first grade. And then everybody levels out. Yep. And there's absolutely nothing special about those babies and those adults that become adults in 40 years. There's nothing special about them anymore.
So that's an interesting study. So okay, so you're doing this, you're working with these people, and what happens when the social worker tells you about the policy?
When I go to meet with the NICU, was very, very much trying to scare me.
Okay,
They're
of course.
Well, this baby's going to have withdrawal symptoms. You don't know know what you're exposing them to. I'm like, excuse me. We have a highly regulated market here. I go to
I know exactly what I'm
dispensaries.
Yep.
I have everything tested. I'm very comfortable. And in fact, I mean, I'm established in this community.
Exactly.
If I have a concern about one of the dispensary's products, I can call that dispensary and I can say, I'd like to come in. I'd like to give me a tour. I'd like to know what you're using. I want to come in. I want to see what you're giving me.
So I guess we should fill it in that you have this is your world too.
This is all I do is cannabis.
so you have a whole full. It isn't just that you are using it for health reasons. This is like your whole world, and you have a lot of knowledge. So
I've been an advocate. I've been an activist here in Massachusetts for cannabis policy reform since 2009.
So you came into this fully armed, and you knew what you were doing.
I did.
You had the facts, and you knew that the people talking to you didn't know what they're talking about.
Yes, I did.
Okay. All right.
So, and I wasn't scared because I've never been scared. I've been like, okay, I'll just fight. I'll just argue with you until you understand or give up.
Okay.
That's one or the other. And so I get through the NICU was definitely the hardest. Like getting out of there and feeling like a bunch of doctors just told me that I was
dangerous,
endangering my child.
Exactly. What a terrible.
Like I'm a professional adult. Like I have an apartment. I have a roof. I pay my bills. I take care of my kid. My kid goes to daycare. Like I had a job. I mean, at that point, there was nothing risky. There was nothing questionable about my life. I'd quit. I mean, I was a cigarette smoker for a long time. I quit smoking cigarettes a year before I started changing medications.
Okay, so
I had been because I was like, I'm going to have a baby at some point. Yeah, I should quit smoking.
You're taking care of your body to take care of another body. Exactly.
I was never. It was hard. Okay. After that,
so were these doctors or nurses or who was talking?
These were doctors. This was the head of the NICU.
Oh, the head of the NICU.
Yeah, I don't remember his name. Okay. But yeah, he made me feel very, very uncomfortable. And my doctor was wonderful. So I met back with my doctor and I was just like, this is ridiculous. Like, why are you putting me through this?
So at this point, were you second guessing your decision to give birth at that hospital?
I was.
You were? Okay.
I told the hospital about 3 weeks before my due date, I said, I'm not having the baby here. Okay. I don't trust you. Mm-hmm. I don't trust this hospital. Mm-hmm. Me and my very good insurance are going to another state. And in fact, in Maine, there is no policy for testing newborn infants for anything.
So that's something you'd research before you would. Okay.
Yeah. Even being open about my cannabis use, they would not in Maine. They would never.
So they never put a policy in place. So
no, there was no policy there. All right. So when I was talking to my doctor became very concerned for a couple of reasons. I was not just pregnant and pregnant women. I have a seizure disorder. I'm in the high risk pregnancy department.
Yeah,
I had 7 ultrasounds. Wow. Yes, I went in almost every month.
And how were you feeling in terms of how was your personal health during this time? Were you having any seizures?
My hormones. Well, at 6 weeks, I had the longest seizure of my whole life. Wow. When I was 6 weeks pregnant, it was 4 days.
4-day seizure. Oh my God.
That's not epilepsy. I'm not unconscious and on the floor for 30 seconds. It's a build. Okay. It's a panic attack or it's a hormonal fluctuation and it's a build and it'll look more like a tremor or a tick.
But we were talking about this earlier about how your hormones are all in flux anyways when you're pregnant, in addition to everything else that's going on. That
it was very scary.
A very scary time.
4 days at 6 weeks. I was in movement. My body was physically moving outside of my control for 4 days. No driving, very little eating, staying in bed.
Which can't be. I mean, I think this is sort of it's the same topic, but what I talk about a lot is that we are the vessels. We're building another life inside of us, and we have to be healthy. Yep. And the idea that we are told that we have to compromise our own health in so many ways. How can you grow a healthy baby if you're tired and anxious and depressed and sad? That's the thing that kind of that's the flip side of this.
It's more difficult.
That you must suffer so that the baby can grow, but a baby can't grow if you're stressed out. All those hormones are going into the baby. All your stress.
Yep. All your cortisol. All of that.
All of it. Okay.
It's not healthy.
All right. So you're telling them you're not going to give birth.
I'm not going to give birth. And my doctor says to me, "Well, have you called patient discrimination
at the hospital?"
Yeah.
Oh, I didn't.
And I was like, patient discrimination. I know, I will. What's the number? Okay. So, and it wasn't, and calling up to patient discrimination at the hospital didn't get me anywhere.
Okay.
So then I called, I figured out who owned the hospital.
Were you involved with attorneys yet at this point?
No, I never paid an attorney.
Never. Good for you.
Nope.
Yeah.
I called when I realized that the hospital wasn't going to be doing anything because the hospital says, well, this is it. You want to change something like that, you got to go over the hospital. Who owns the hospital?
Okay.
Partners Healthcare.
So you did it.
Partners Healthcare has their own patient discrimination.
Okay.
And now, I'll be really frank. I have been in the cannabis space for a long time as an advocate, and I have never used my activism or my connections in a way that was, threatening to someone else or would make somebody or would possibly make somebody uncomfortable.
Right. Okay.
Until that day.
Okay.
Until I was on the phone with Partners Healthcare and the patient discrimination office, and I said, "You clearly don't know who I am."
Right.
I want you to go ahead and Google me, and then I want you. And this is so bad, and I've never done it since, and I felt so terrible afterward because it's just such a bratty thing to do.
But you know what?
But I had to protect my kid.
Yeah.
What am I gonna so fine?
You're a mom.
All the tools come out of the tool belt.
Exactly.
And I said, if you do this, I will go to the news. I have people who will support this. I can have activists lining the streets, my street, all the adjoining streets. So anybody that comes from DCF or the police that wants to investigate my house, you are going to walk by the cameras. You're going to walk through picket lines. You're going to walk through activists. You're going to walk through
explain what you're doing.
A hot mess of people trying to figure out why you are harassing my family.
Exactly.
And everyone's going to hear about it. So I just want you to know, I don't want you to do this. This is ridiculous. I am a legal patient. I am using appropriately.
Carefully.
Carefully. Throughout my pregnancy, I did not smoke.
Okay.
I mean, maybe I took a couple puffs here and there the same way somebody might have a sip of champagne.
Exactly, right.
At a wedding or something.
Right.
But no, I didn't drink. I didn't smoke cigarettes. I didn't share with people.
All right.
It's very common that people, pass a joint or pass a vape pen, pass a whatever.
Yeah.
No, when I was pregnant, no. If it only touched my lips. And it was only the cannabis that I specifically needed for my issues. There are certain cannabis varietals or cultivars that make me feel worse. There are certain terpenes
you know this enough.
I know. Yeah. I know it's my body, and I know my choices on cannabis so well that I said I'm not touching anybody else's
you're
stuff.
using it for your health.
I didn't, and I was very, very, very responsible. I only vaporized. I used tinctures. I used topicals when I could, and I treated it very, very seriously.
And how was your pregnancy? Were you reasonably healthy? Did you make it through?
Yeah. No, I never had high blood pressure. I didn't have diabetes. I didn't have any. And aside from the one initial seizure, I didn't have any additional seizures.
So you went through it?
I mean, it was very stressful. I definitely had my share of panic attacks.
Right.
But, there was only so much medication I could take. I couldn't take any of my emergency meds. I keep Valium and I keep Zoloft and I keep, Dilaudid just in case I have a major attack where I'm unable to move.
But for your pregnancy, you were able to manage your symptoms without your other meds.
Yeah.
That's good to know, actually. Okay, so did you talk to them about? So this is just one hospital. So when you asked them why their policy existed, could they give you an answer?
No. I don't even remember if I asked. They said at the end of that conversation, they said they would review my case and get back to me.
Okay.
So I go in for my final checkup with my doctor that I'd been seeing before I was going to go to Maine.
Okay.
And be a new doctor.
Yeah.
So my final meeting with my local doctor, she comes in and she goes, "Why aren't you smiling?" I don't know. Where should I be? She goes, "I just heard back from the hospital. They're not going to file the 51A, and they're going to change the policy because you're right." I said, "Really?" She's like, "Yeah, they're changing the policy in birth and delivery, fetal maternal medicine, and the NICU."
Did they show you the policy? Did they ask you?
They didn't, and I have followed up a couple times, and I have not heard back official words. I have not seen the official hospital policy, but I was told that it changed, that they were not going to do this to Canna Moms anymore. They were not, because it's legal.
Right.
They were going to treat it the same way they treat tobacco and alcohol. If it's in your system, then you just made an adult decision.
Exactly.
Go for it.
And have you heard if any of the hospitals in Boston, are they following suit? Have you heard any of the stories?
I haven't heard any other stories.
And have you?
I so many moms, future moms, reach out to me, and they're like, what do I do? And I was like, you need to be honest. You need to call patient discrimination. Just first thing, call patient discrimination. That's it. Just call them. Call them first. Don't talk to anybody else at the hospital.
Anybody,
you are being discriminated against, especially if you are a patient. If you have a medical card in whatever state you live in, if you have a medical card, that is patient discrimination.
So that's
medicine.
That's our big takeaway today, moms. If you're out there and you're in a hospital anywhere in the country,
call patient discrimination first. Because if you're a legal patient, if your state has a medical program and you're in it, then you're in it.
And you're a patient and you have rights, and those hospitals need to take care of your rights. That's interesting. So that's just one hospital and one small.
Yeah, if I have another baby, I'm gonna have to go to another hospital and change their policy. There's a lot of hospitals in Boston. I better get to making babies.
So that's let's go to Jamaica. Anyway, so that's just your one story in terms of you're with your son. So what's happened now that you have a child?
Yeah,
and you're out in the world.
2.5-year-old.
So I talked about this a little bit last week with my guest. So her children were 5, 8, and 10, and mine are 17 and 20. So those are really different conversations. And your child's toddler. Yeah.
I know.
So is there any awareness? Is your child, he's just a kid.
Does he know about mommy's medicine?
Yeah.
And he knows not to touch it.
Okay, just like any other medicine. Okay.
No, it's funny. An empty doob tube, a joint, plastic joint holder for those who aren't familiar with the terminology. An empty one.
Yep.
It rolled off of a tall shelf, and he picked it up, and he goes, "Mommy, it's your medicine. You dropped it." And I said, "Oh, it's empty. Can you throw it in the garbage for me?" And he goes, "Did you take your medicine?" I'm dying. I'm like, yes, Mommy took the medicine. You could throw it away. And then he couldn't. It was childproof.
Yeah.
So I opened it for him and I showed him it was empty. And he goes, okay, you took your medicine.
You did a good job, Mom.
And he threw it away.
So I will say, it's very normalized for your child.
Yeah.
So for my kids, I got into this. My son was 16, 17. And when I came back and talked to him, we went to a tour in Denver. We saw a legal facility. It kind of blew my mind, and we came back and we sat my son down and said basically everything we knew was wrong.
Everything we told you was an oops.
Oops, sorry. And this is a whole different.
Course correct.
I know, course correct. But it is that they're taking their information from me. I had bad information. I didn't understand what cannabis was.
Yep.
And this has been an eye-opening experience for me, just in terms of what's normalized. And my 17-year-old, it's just very normal to her. Mm-hmm. It's almost like. There's just no hiding. There just isn't any hiding anymore. I was reading a story in Forbes.
You're not doing anything wrong.
Yeah. Well, I was reading a story in Forbes today about moms and cannabis. And just there's still such a stigma that there's some crazy number of women they don't tell anybody. They won't, their professional networks especially, like 80% won't tell their professional networks. And it kind of tumbles down where.
If you're ashamed of yourself, how are we going to fix this?
Exactly. So if you're hiding this, if you're in the bathroom taking a hit, spraying it, and then trying to act like, I don't know, it's supposed to take away your anxiety. That's part of the business. And I did not smoke cannabis when my children were young. I probably would have been a happier, more relaxed mother. I was very stressed out. I was working. I was an attorney. I was working. I was always on that role. And now I know I could have taken a hit, and I could have just that moment.
I'll tell you what.
Yeah.
When I'm, if it's the end of the day and I am, I'm stressed out about work, or I'm stressed out about some state releasing some ridiculous policy, or I don't think that the commission is doing their job, and I'm feeling anxious about what's going to happen with my career based on what the commissioners are doing.
Right.
And, and then my kid's sitting there, and he and I live in an apartment. I'm divorced now, so we're there, and he's going, "Mommy, play with me," and my head is spinning with all of this stress and anxiety. I say, "Hold on,
exactly.
Mommy needs a timeout."
Yeah,
and honestly, I do go to the bathroom because I'm in an apartment. I'm not supposed to smoke in the apartment.
You know what I mean.
I have a ventilation thing. It's just easier to go into the apartment than to try to go out on this tiny little balcony over Route 9.
It's more about it's like that thing, you smoke and then you're hiding it. So and then you're like,
I'm not hiding it though. I go, Mommy's going to take a timeout. I gotta go take Mommy's got to go take medicine.
I took timeouts all the time. I used to hide myself in the bathroom.
I don't hide though. I literally go there because of the ventilation is available in there. But he'll come in and he'll go, "Mommy, you feel better?"
Yeah.
And I'll be like, "Yeah, I feel better. Let's go play with your trucks."
Yeah, and then you can be in the moment with them.
With him.
It's being in the moment.
Absolutely.
I think that's really,
and I don't get, it's not like, having a couple hits off a joint or out of a bowl is, the same as, having, half a beer.
Yeah. I mean,
like, can you as a parent that drinks alcohol, not you specifically, but the proverbial you as a parent, drink a beer and feel comfortable being in the control of your child? Yes.
I mean,
same for me, using a little bit of cannabis.
But wine was like almost a necessity in my era. Like, it was like, it was just...
mommy wine culture is a thing.
It's a huge thing. And I would much rather, I actually have stopped drinking for the most part at this point. I have. And I don't ever feel, I'm never tired in the morning. I never feel hungover. I never have that moment that I used to have when the kids were younger and I let myself drink. But I would never let myself use pot or cannabis unless I was with friends. We would go away. It was like a special thing to do. It's really an interesting culture change. And now that I talk to moms who are using this in more of a normalized way, I can see how it probably could have helped me. I mean, I was very...
high anxiety, high functioning type A women managing children and careers. You're wired. It's like you're on a natural cocaine high all the time. Where there's no way you're going to get everything done to the expectation you have of yourself.
Yep.
And to try to meet that like somebody was aggravated with me recently and said, "Oh, must be so perfect to be perfect all the time. Must be so great to be perfect all the time." And it's like you have no idea how much energy I put into getting as close to that as possible, literally 24/7.
Yeah.
It is exhausting. It is anxiety. It is stressful. It is constantly failing myself because I'm never going to be perfect.
Exactly.
I'm constantly failing myself by setting myself at those expectations.
Right.
And all the medication in the world and all the therapy in the world, sure, maybe you can go Dalai Lama and figure it out. But in reality, that's not my life. No, it's much easier for me to consume a small amount of cannabis and be able to let go for a second. Let go of the turtle. That's not the real turtle. Let's say there's a toy turtle on the floor. I can let go of that for 20 minutes. And I can pick it up and put it away after my son goes to bed instead of feeling like your toys are out everywhere and now it's messy in my house and it's not,
I would come home. So I was an attorney. I was a litigating divorce attorney, and I would be in that mode. I would still be in that weird headspace mode, and my kids were little. It's very hard to decompress. It is very, very hard, and you have to do it really fast. My husband would come home and go upstairs and have a little time in the bathroom and relax, and then come down and be with us. But when I came home from work...
You have to go... You picked him up, then you had to go grocery shopping, then you have to make dinner, and then you have to clean up after dinner, and then he's got to go take another time in the bathroom, and then you got to give all the kids a bath, and then you got to put them to bed, and then you got to clean up after the day, and then you got to finish your work for the day, and you got to get ready for the next morning and prep all the lunches. But it doesn't stop.
And it felt normal. It was just like that kind of crazy routine.
Yeah.
And there wasn't that break where you could kind of let your head go. So I can see how it'd be very, very useful.
I find it helpful. And I think that the other moms I've talked to that use cannabis feel the same way, that they're able to be more present in the moment and less stressed, less anxious, less focused on
I think it's a present in the moment because your kids are only little for a while and you can miss it really fast. And if you can't be in that moment with them, you're not enjoying it.
Yeah.
Or else you're just, because they're not, that's the whole thing about being a mom. You have to learn to live in their world.
Yep.
Yes.
Oh, yeah. The dinosaurs were chasing us on the way home yesterday. I heard about it for the whole 20-minute drive home where I was not using cannabis because it was not appropriate to drive and use cannabis. And
It's interesting. So actually, all right. So we've gone through your policy. We've gone through what you did for your change. What do you think? What do you see the future in this in terms of moms and cannabis and hospitals and pregnancy? And have you talked to people, a vision? Do you have
I think that women should do what they're... I'm so sick. People telling everybody to do what women should do with their bodies. Leave us alone.
But after the time, can you see policy changes or perspectives changing or...
Oh, absolutely.
Yeah.
Absolutely. It took 75 years to get us here.
That's true.
Before 75, 80 years ago, everyone used cannabis.
It was just part of our natural. Yeah, exactly.
Every single pregnant woman who had nausea used cannabis.
Right.
Every one of them. This is not special. This is not exciting.
But that's also the thing that I think the message that we have to get out again is that this is an anomaly in history. These 80 years are really an anomaly, and they were created by a man.
Yeah.
Who was... White men. Who had...
White landowners.
Yeah. Misogyny and racism and all sorts of other components are engaged in this law. I mean, the way that we decided what cannabis would be. And now we're re-educating people. And we've talked about this. It's so hard to convince people when they're wrong. It's so hard. Mm-hmm. And I think part of it we can do with humor. People seem to hear it through humor better. But the idea that all this misinformation is really impacting, women's health in a very negative way if we aren't able to take care of our own bodies. And, right?
I think if a woman is comfortable using cannabis when she's pregnant, use cannabis. Yeah. Use it responsibly.
Just like anything else.
Don't go out and go party all night. I wouldn't sesh. Again, a sesh is, when a whole bunch of stoners get together and hotbox a room or, a couple hours they spend just like getting lit.
Right.
Don't do that when you're pregnant. That's not good medical use when you're pregnant.
No. And as you grow older, it's not such a good idea either.
It's not really that much fun. It kind of gets boring and everybody starts falling asleep.
But the idea that, this substance, it's so many uses and it's got so many ways of
anti-inflammatory.
Making us healthy. Even the CBD things my husband was talking about, the New York Times had a big story about what CBD can do. And he was talking about the ADD stuff. Mm-hmm. And how you get, that's a big issue for him. He doesn't like being on the medications he's on to help him, manage himself. And if he could use CBD or if he could use another substance, he'd be very up to that. But again, it's getting the medical community. Where do you see them, like in 5 years? Have you seen you've seen a big change, honestly?
There's been a big change since I got involved in cannabis. I think what is really, really crucial to the medical community now is that medical schools start mandating cannabis.
I agree,
medicine, and it is part of their baseline curriculum. Mm-hmm. So you have your core studies. Yep. In your core studies, we have to get medical students learning
Have you heard of this happening anywhere in the country?
There are a handful of continuing medical education programs, CME for legitimate credits.
Okay.
There are a handful, but not in medical schools, not for
nursing schools or.
They may touch on it, but it's not it's not sufficient.
I feel like
most nurses I know learned about cannabis on their own with their own research.
Exactly.
I don't know any nurse that learned about cannabis in school. I don't know any doctor that learned about cannabis in school, except for doctors who went back for CMEs.
Trying to learn about it. I even think about with the presidential candidates, there almost needs to be a cannabis. There needs to be a policy. This means something bigger, because this touches so many issues. Cannabis is.
See, I like no policies.
I know. You're like a libertarian.
No policy means I'm not doing anything wrong. Get out of my business.
I enjoy that, but again, we do live in a country that has some laws. So
we do. We have some good laws, some pretty crappy laws.
I know.
But I just, I don't want more legislation on my body. Right. I don't want more approvals. You start going, okay, well, cannabis, moms can use cannabis if they use it this way, or if they don't use more than this, or blah, blah. And it's again, we get into this issue of a mom who has, tennis elbow versus a mom who has MS.
MS, right.
You're going to use differently.
Right.
They're going to need differently throughout their pregnancies.
I think in general, we just don't want people telling us how to
stay out of my bedroom, stay out of my wallet, stay out of my house, stay off my property.
Yeah. Or, penalizing us for taking care of ourselves. Yeah. That's really what this is. Mm-hmm. Where, women trying to take care of themselves so they can take care of others. That's really what this conversation is about, is that how do we best take care of ourselves? And cannabis is part of the conversation right now.
Absolutely.
Oh, I think we're out of time. Can you believe it? Anything else you want to share with our audience before we...
Just stick up for yourself.
Stand up for yourself.
And don't lie to your doctors.
Yeah, but transparency. If you're using it.
Use it. Tell everybody. If you're comfortable using it, then you need to force people to understand that you're not doing anything wrong. And if you think you're doing something wrong, then you are. Exactly. It's like one of those
self-fulfilling prophecies.
Yeah, whether you believe you can or you can't, you're right.
Exactly.
Well, whether you believe you're doing something wrong or not, you're right.
Right.
I don't think you're doing anything wrong, but if you think you're doing something wrong, you have to go hide and you can't tell anybody. You feel ashamed after you do it, or it's some secret.
Yeah.
No, then you're not using it right. You don't understand what you're doing.
Exactly. No shame.
Yeah.
We're taking care of ourselves. This is health and wellness, people. We want to take care of ourselves so we can take care of our children. Mm-hmm. Well, that's great. Well, that was another episode of Canna Moms from my great guest, Cara Crabb Burnham.
Thanks for having me.
You're very, very welcome. I'm your host, Joyce Gerber. and this is Canna Moms on the Pro Cannabis Media Group.